Welcome back, health enthusiasts. Today, we're tackling a topic that demands our attention: thyroid storm. If you're unfamiliar with this condition, don't worry, you're not alone. In this video, we'll be exploring the symptoms and crucial care strategies following an attack. Whether you're a patient seeking answers or a caregiver supporting a loved one, understanding thyroid storm is essential. So, grab your notebooks and let's dive into this vital discussion. But before we do, I want to emphasize the importance of hitting that subscribe button. By subscribing, you not only stay updated with our latest videos but also join a community dedicated to spreading knowledge and empowering others. Your support means the world to us and helps us continue creating valuable content for you. So, if you haven't already, click that subscribe button and become a part of our growing community. Together, we can make a difference in our health and well-being. Thank you for your support. Thyroid storm, signs and treatment following an attack. A thyroid storm, also known as a thyrotoxic crisis, is an uncommon but potentially fatal illness brought on by abnormally elevated thyroid hormone levels. The most common cause is an underlying hyperthyroidism problem, such as Graves' disease, which is an autoimmune syndrome characterized by an overactive thyroid gland. The risk may also be increased by other variables, such as an infection. Thyroid storm symptoms can range from mild to severe and include high fever, between 100 and 106 degrees, a highly elevated heart rate, BPM, of up to 200 beats per minute, breathlessness, chest discomfort, and palpitations, elevated blood pressure, delirium, confusion, and possibly psychosis. Thyroid storm complications can result in fatal heart attacks and strokes. If you suspect a thyroid storm, you need to see the ER given how rapidly it can grow and intensify and how life-threatening it is. Thyroid storm has to be treated right away. Triiodothyronine, T3, and thyroxine, T4, two essential hormones for thyroid function, are typically produced in excess by the thyroid during thyroid storms. Your body temperature, blood pressure, and heart rate may rise uncontrollably as a result. In order to expeditiously start therapy, medical professionals have devised a scoring system that aids in the early assessment of symptoms and presumptive diagnosis of thyroid storm. The apparatus is used to measure heart rate, temperature, symptoms related to the digestive system, and neurological problems. Blood tests are occasionally performed to check for elevated thyroid hormone levels. It's also possible to perform a TSH, thyroid stimulating hormone, test. However, as thyroid storm is a medical emergency, treatment is usually initiated right away, with little time to wait for test results. Healthcare professionals usually employ a variety of measures to try and disrupt the high thyroid hormone levels that are the cause of thyroid storm. One kind of treatment is to use antithyroid medications to block the manufacturing of thyroid hormone. Larger initial loading doses and frequent administration of further doses are usually applied immediately away. Lithium is occasionally used in patients who cannot take antithyroid medications. Using a beta blocker medication to lower heart rate and blood pressure, such as propranolol. In addition, fluids to prevent dehydration, cooling to help lower body temperature, and treatment for any additional infections can all be included in supportive care. If the therapies are effective, the patient will usually notice an improvement in 48 hours. Plasmapheresis, a blood filtering procedure, is occasionally used to eliminate thyroid hormone from the bloodstream when thyroid storm does not react to these treatments. Thyroidectomy is a rare surgical procedure. Not every patient with thyrotoxicosis or excessively high thyroid levels will experience a thyroid storm, which can be addressed with medicine or even surgery. According to one study, thyroid storms occur in 16% of hospitalized thyrotoxicosis patients. The mortality rate is higher in patients with thyroid storms combined with thyrotoxicosis than in patients with thyrotoxicosis alone. But the important thing is to treat. Those with an untreated thyroid storm have an 80% to 100% death risk. Thyroid storms are less than half lethal when treated, some studies indicate a rate as low as 10%. The prognosis is also influenced by underlying health and age. Results for those who went into a coma during a thyroid storm are less favorable. Thyroid storms that entail cardiac events, such as arrhythmia and heart failure, are also linked to poor outcomes. Individuals with underlying obesity, chronic obstructive pulmonary disease, COPD, and liver problems are more susceptible to these events. Synopsis: thyroid storms are uncommon, but they can be fatal. An underlying hyperthyroidism, such as Graves' disease, is typically linked to the symptoms of an excessively high body temperature, rapid heart rate, and extremely high blood pressure. Diagnoses and treatments for thyroid storms must be started right away. Medications that inhibit thyroid hormone activity and lower vital signs are usually utilized in this regard. At least 80% of thyroid storm instances end in death if treatment is not received. And that wraps up our discussion on thyroid storm, symptoms and care after an attack. We hope you found this video informative and empowering. Remember, knowledge is key when it comes to managing thyroid conditions effectively. If you have any questions or would like to share your experiences, feel free to drop a comment down below. Your feedback is invaluable to us. Don't forget to like this video and share it with anyone who might benefit from this information. And if you haven't already, be sure to subscribe to our channel for more insightful content on health and wellness. Thank you for watching, and until next time, take care and stay healthy.